Hi, this is Dan Ostrovsky, and I'm going to talk about how I use DynaMed Plus in clinical education. I had a resident present a patient who was 60 years old who he reported had bilateral knee pain, which was persistent and lasting for almost a year, and had noted that it had become increasingly more difficult for him to walk far distances without pain. Also, he noted that the patient reported it was tough for him to get out of bed in the morning, but that the knees loosened up as the day went on. There were no other red flag symptoms. He wanted to obtain knee x-rays to make the diagnosis of osteoarthritis. I asked him how helpful would x-rays of the knee be in either confirming or denying the diagnosis. He said he really didn't have a great idea of how helpful it would be. So I said, let's be more sure. So I had DynaMed Plus open up on the desktop, and I typed in osteoarthritis, and first thing we got is OA of the knee. His focus question was related to the diagnosis. So I said, why don't we go to the diagnosis tab? And I said, specifically your question was about x-rays. So let's look at x-ray. And I pointed him to the EULAR recommendations on plain radiography for the diagnosis. And you read through that it is the gold standard for making the diagnosis. However, radiographs are an adjunct rather than the central feature for purposes of diagnosis, and they may be normal because radiographs are typically insensitive to early features of OA. And then I scrolled down a little bit because I wanted to present some primary evidence and not just a guideline, and to find out, well, how good are the x-rays in fact? And I see a conclusion statement, and I pointed out to him that standing anterior posterior and 45-degree posterior anterior radiographic views may have low to moderate sensitivity but high specificity for severe knee OA. And I said, and it's based on systematic review of several studies. And so I said to him, basically, if you see it, it's helpful to know that it's OA. However, normal x-rays aren't going to help you. And in this patient, with what we just discussed in making the diagnosis, that you could be fairly confident, based on just the history that he had taken, that in fact he already has a diagnosis of OA. And again, to give him some help, I scrolled down a little bit, and based on the clinical criteria, we saw that it had a sensitivity of 95% and a specificity of 69%, and x-rays had a sensitivity of 91% and a specificity of 86%, so not all that different. So in the end, it changed his management because he said, you know what, I don't think it's necessary to order him an x-ray at this time. Let's treat him empirically and follow up. And that's how I try to teach them to use evidence-based medicine at the point of care.